Sunshine's Corner, being brought to you by Quint and Richie Studer. And we are up early on a Saturday morning. You know what? When I tell you that Sunshine's Corner is on every corner there is in Pensacola to make sure that you get all the information that's needed, that's what we're doing today. Look, it's not Friday, it's Saturday, and I am out having a fantastic time. I'm here with my partners, Baptist Healthcare, and we are doing our very first tour. Yes. Okay. Look, guys, don't think this is Wellness Wednesday, is Wellness Saturday. Yeah, it's Saturday. Wellness every day. I was just going to say that. But look, I want to say to my guys, I got Joy, and we've got Melissa here, and we're going to talk about so everybody can see it here and be a part of this wonderful. Tell them we're not leaving up. And you see, this was so important to me that I think it's absolutely fantastic that you all are stepping out to do this at a time. When people can get up on a Saturday morning, come out and find out. And what I love about it, there's a great big word in the front of it that says FREE. I mean, from every screen in there. Joy, talk to me because I know you're passionate.
Yeah, so it's remember I have to say it's not free, it's no cost.
There you go.
Because it's costing someone something, right? So today we have we're screening on wheels. We have mammography, mammograms going on for women. We have PSA with the prostate checks for men. We're also with one of our partners doing developmental screenings for children that are 3 and 4 years old. We're also doing blood glucose for your diabetes, for your sugar check.
Let's say sugar.
We're doing that. We're doing height and weight, blood pressure, vision screenings. It's just amazing. We have free Narcan. It's a whole lot of partners in there, and I can't wait for you guys to hear some of the things that they're going to say.
And I'm coming to you, Melissa, but I want to say this. We didn't talk about this on the show, but the fact of it is that they've got free Narcan here. Everybody knows what epidemics we are experiencing now in our community.
Right.
It is so important that you understand how to use it and that you can get it to save somebody's life.
Correct. Correct.
And that's a fantastic thing right there. Girl, you better go on, keep talking me with all this good stuff. And Melissa,
Yes, ma'am.
I see that smile on your face. So, I mean, just the other day we had it on Wednesday.
Yeah.
And I could see, when you enjoy something that you're doing, you don't call it work.
Right.
When you're doing something from the heart, you do not call it work because you're helping somebody else. And I see that really all over you.
Yeah.
Talk to us the exuberance, the joy that you feel today.
I think that's just something that has always been ingrained in me. I'm so proud to work in oncology, cancer support services. We talk about all the time normalizing conversations about cancer screenings and what does that look like, being proactive in our healthcare. So today, as being able to provide prostate cancer screenings at no cost, not
At no cost,
not
not me.
now, but to just even be able to get men to be able to get that baseline of where they are. You might not even have a finding, but at least getting that conversation started with them, talk with their primary care, their family doctor.
There you go.
Family doctor.
Bring it to them what they like.
Bring it on back around. Bring it on back around.
Bring it on.
But yeah, so I'm just excited to be here. I'm so excited to see all the vendors that are here. We have a lot of goodies. We have a lot of giveaways today. We'll have some food, some refreshments, some lunch provided as well. So we're just trying to hit all of the main areas so that companies come here and take all of their worries off and just come and get the information.
And you know what we're going to do today, Joy? We're going to prove everybody wrong. Because they always say it's so hard to get to get men to come out.
Oh, we got one already. We got one. He already told me first thing. He said he got to do two things. See, Florida Blue, they are here too. So if you are uninsured, underinsured, need some information about insurance, come on out. They're here right for you today. But yeah, he already told. He already told.
He already made us aware.
And you know what? I gotta say this. Everywhere I go, you know who's on top of it as well with the Gulf Coast Minority Chamber. I walk in the door. Who did I see first?
Brian
First thing.
I mean, but that's great because therefore he's putting something in the community that's needed. You know my philosophy. I believe if we connect all those dots together, there is nothing that we can't do because we've got a strong foundation to hold it up to get our community what they need. And today, with all of that being provided, and I mean, what got me? When I walked into the door today, it was like so refreshing. It's not that I'm coming to an event that can save lives, which it is, but the joy that not no joy, but the joy that I feel. What can you say, right?
Yeah.
That I felt when I walked in the door. How is it that with your team and what you do to have that ambiance when you walk in the door. Does that make you feel good for the people that's gonna come to that?
Absolutely.
Yeah.
Absolutely. We're cheerleaders right now. We're on the sideline waiting on the main characters to walk in so we can cheer them on. Community is the main character. Our mission at Baptist is helping people through our life journey. And this is just a small part of us bringing the mission
To the
mobilize.
there you go.
Because
See, when you said two are not gonna cross you,
yeah,
every
that's
time
the
I
first
say,
leg of the tour. I mean, this is I'm changed clothes about 3 times. You know, that's what they do it. Like, oh, be on
Yeah, he's trying to get the time.
about 3 times.
I mean, but when you come up with this idea, I think that's so fantastic. And it's so relaxed.
Yeah.
And I see the people that are walking in, even, I mean, just it's in the air, should I say?
It's that serving spirit we talked about.
Right.
Like we're here to serve, right? So I think it makes it easier to be able to come to a situation like this and be happy, be excited. Because ultimately our goal, regardless of what vendor here,
Right.
what training is here, is to be able to serve the people that are in our community.
Absolutely.
So it's a time to be happy. It's a time to smile, to greet people, have them come in. Because if you come in and you see people just unhappy to be there, like we're not be here on a Saturday. No, we're here on a Saturday. We took time out of our day to make sure that we create an atmosphere.
Absolutely.
Right.
And you know, I think I've always said this, that you in order to reach people, you gotta serve.
Yes.
Reaching our community by serving.
Yes.
And this is service today, top notch.
Yes, ma'am.
I gotta give it to you from the heart.
Yes, ma'am.
You went above and beyond to make sure that those in the community are not lacking in what's needed. I always have to bring this up because I think this is a source that we see when we do talk about things that needs to be talked about. That is what this show does. Okay, those uncomfortable conversations, we can have them. And you can feel comfortable sharing them with you. And I say that to say because when June was on maybe a month or so ago, 2 months ago, we were sitting there and a gentleman walked in the lobby and he waited. What we were talking about was so needed by him. He did not know how to get the services that he needed. But this man wanted it so bad. I said, well, you know, we're on camera right now. He said, that's okay. He did his legs like that. He said, I'll wait. But he waited. And to say that she was there to deliver what he needed, got him taken care of. This man was down to no medication. And that's a point for you, Joy, that shows where people, they don't feel like, you know how sometimes people are afraid to approach it?
Yeah.
And you have to get rid of that facade. You made the man feel comfortable. You got busy with your business card. He sat there. Need some coffee, sir? I'll wait for her. But the fact of it is, this is what you do. That should put another on your back because of how you stood there. You did not leave that table. It came into your day to get him what he needed. But that's what you do. That's community service.
That's what we do, right? We could not exist without the heat.
There you go.
And we believe at Baptist that we can take healthcare to community. Because if we wait on them to come to us, we want to do it as preventive as we can. So when you hear us say things like early detection,
Save lives.
that's awareness. And so just like there's a lot of screening, there's a lot of knowledge in there as well.
Exactly.
And so that's what we do. That's who we are. We exist because of Northwest Florida.
Exactly.
And so he, his situation was dynamic.
It was dynamic,
But
but you
we were
had.
able to get him to, and a couple of the vendors that he went to go see are in that room right now.
Really?
Yep.
But you see, I say that to say because if you hadn't had that, sometimes when you meet some people, oh, no, you need to call over here, do that. You need to go take care of that. No, it was like, what you need?
Yeah.
How can I help you?
Yeah.
And that made him feel so welcoming to share because he had shared with me. And God knows, I said, well, honey, I don't know what to know.
That's right. That's right.
I said, but there's one person I think I can call, I can connect you with that can help you. And you did that. I want to say that to those who know if you aren't during the week, but if you're on the weekends, to say this. Thank you.
Thank you.
Oh, thank you for doing what you did. Thank you, because that guy had been down to that studio 2 or 3 times. I didn't know that. I'm a talker.
Yeah.
Okay, that's what I do. Yes. Now, when we say, now today is the 27th of September. A couple of days is gonna be October.
We ready.
Yes, ma'am.
We're gonna roll
Right
the
back
rest
to
of
the
the
progress.
We'll be right on back there Wednesday talking about.
That's right, because that's gonna be Wellness Wednesday.
Yes.
But now, what do you want to say to women who are watching this morning to get them here to go ahead and get the screening that they need?
Yeah. just come through the doors. Just come through the doors. Even if it's not here today to get your mammogram, we have some information here. We have brochures to show how to do your own self exams because it starts.
Hand up.
Right. Yes, ma'am. It starts with you. Before you get any screening, before you talk to any doctor, we have these two hands that we can do our own exams. Your partner can help you do exams at home. You know, you can feel for anything suspicious, so you feel empowered in a conversation. Exactly. With the doctor.
Exactly.
So come through the doors. We have the information. We have brochures. You don't have to get the mammogram day. You don't have to fully commit. We can just have the conversation today.
Most certainly.
Yeah.
And when you said something about with the help from your partner, I think that was last year when you were
Yeah,
on.
that's last year.
Yeah.
I think it was last year. But a gentleman called. He said, "I know my wife bites."
He did. And he found her.
That's true.
He found her.
She found it.
Yeah.
He found her.
I mean, come on, but that's partnership.
Yep.
And what you all are giving for the community is more than just a tour. I mean, I call this love. Love is an action word.
Yeah.
It is.
You show your love by what you do.
Right.
Your actions speak so much louder than any word coming from your mouth.
Right.
And but what you're doing today shows love for the community, love to get people what they need so that they can enjoy their lives without all the stresses that we're already going through. I want to commend you on that as well. And for those who are at home today, you're wondering why, this is why. Do what you got to do to take care of you. You only get one of these.
One temple.
You got one temple.
Let me give him the address.
Give him the address.
9400 University Parkway. Right, almost counter the corner of University and 9 Mile Road behind the Circle K. You'll see the balloons, you'll see the little flag sign. Come on.
And you're going to see a sign say, parking. Follow that sign.
Yes. Follow the sign. Yes.
Follow
Follow
the
the sign.
I was doing like this. I said, "Ooh, who's making that go?" I said, "Let me read. Follow the sign."
And every 30 minutes on the 30 mark, our Andrews Institute, they're here talking about fall prevention and movement and doing hands-only CPR, so it's enough for the whole family.
Bring everybody out. Don't leave anybody at home.
Yeah.
And
So
that's
everybody,
JD said, bring them out, bring them
bring them out. Bring them out.
Bring them out.
But it's so great. And I'm so glad that you all asked us to be a part
Yeah.
of this because I think the partnership that we're building is only to continue
Right.
what we're doing to keep the community involved,
Right.
keep them filled with knowledge,
That's right.
so that they will not lack on anything when it comes to taking care of this temple.
Uh-huh.
The only one that we have. The only one that we're ever going to get. So, ladies and gentlemen, do yourself a favor. Come on out. Call your neighbor. Now, if you want to say, come on, let's ride out a little bit today. Let's go over here off 9 Mile Road, right there off University Parkway. You're going to see all those balloons. You don't even have to stop there. You got stuff back there for you to snack on. I see. I saw coffee and water and juice
And fruit.
And fruits.
right up my alley.
Yes.
I mean,
Look, and fruit.
And fruit.
Yeah.
right up my alley. That is my kind of
To
stuff.
help.
They may have to run me at, but but it's all good. And all I can say is my hats off to you. And the things that you do continue because the partnership that we have is all about reaching our community. One voice, one community, one purpose.
And I say one band, one sound.
Come
So we
on
can
now.
all have the same cadence.
Amen. Amen. And the invitation to the guys, and I want to really prove us all wrong.
Come on out.
So let's get out of that old cliche where people say it's hard to get a man out. Men don't want to come out there look at Jimmy over there. You know I'm right. Well, Jimmy said to
Don't
me,
break his hip on that.
Okay.
Call his name on it.
well, no, this here is Jimmy Blair.
Oh, okay. I'm playing. There you go.
This is Jimmy Blair. Okay. He was talking to me, well, Sonshine, I think I'm gonna have to come over there.
He told me Wednesday he was coming.
Because it's not, it's the blood drawn.
Yeah.
And he was afraid of the
No.
old
Non-invasive.
non-invasive.
Non-invasive. Yes.
Now he's giving me a peace sign. I wonder why.
Y'all.
We want to keep it low risk today. Low risk.
You see that? That's so funny. But
Yeah.
he said he was going to come. So we're encouraging everybody to do
Yes,
the same
definitely.
thing. If you will, to come out to this event today. It's going to be from 9 until 1.
One. Oh, y'all know if you go in your medicine cabinets
Oh, those old
and
people.
all that old medicine, bring it in. So we have disposed of the property.
Oh, really?
Over the counter prescription. The only thing we cannot take is aerosol and syringes. bring so we talked about the opioid crisis.
Right.
A lot of that is because that's learned behavior. If I talk about my culture, I'm gonna take all of the pills for about 3. Just in case I get some more symptoms.
And save it for later.
No, we're not in that anymore. We're not doing that anymore. Bring them on and let us dispose of them.
Let me ask you a question before you say that, because some people, I can remember my mother and father rest their darling soul. But the fact that how long is that people think they can hold that pill? And they can keep taking it when it said expired last year.
We're not used to looking at dates.
We don't look at dates.
Not on medication.
Look in the
Really on
refrigerator.
anything.
The mayonnaise be 4 years old. Let's be clear.
If it don't smell bad,
It's staying
we're gonna still.
That's my mother. She used to go, it's all right, baby.
It's all right. You're gonna be all right. We've been eating this mayo for 3 years. Ain't nobody died. We'll be okay.
But you know,
But no, I need y'all to bring that old medicine for real.
I did not say go in the refrigerator out.
Don't bring that up here.
I said,
Yeah,
bring
no, we
your
don't need
medication.
medication.
Yeah. I eat this ketchup.
Yeah, no ma'am.
Or
Drug
drug exposure.
Yes, ma'am.
Someone that you've been caregiving for has recently passed and you don't know what to do with the medicine, so drop it off. Actually, you can drop it off at 9 Mile or the Towers Pharmacy any day. We're just having a special one here today.
Absolutely. And ladies and gentlemen, don't let this opportunity pass you up, because this is one of a lifetime. This is the beginning of the tour, and you can be a part of it. As we do what we do, and I always tell you, when you want to find out what's really going on in your community, follow Sonshine, because she is the voice
Yes, ma'am.
of this community. We'll be back with more right here on Sunshine's Corner, out and about.
Good day, Pensacola. Welcome to a new segment on health and wellness sponsored by Baptist Healthcare in partnership with Sunshine's Corner. Every first Wednesday of the month during Sunshine's telecast, we're going to be bringing you information about health and wellness and ways to make sure we're improving the quality of your health care here in Pensacola. After all, we want to ensure that you're going to the right place at the right time and for the right reason, and that you don't feel alone. Can't wait to see you.
I'm Emily Echeverria, Marketing Communications Director for Council on Aging of West Florida and the host of Coming of Age. Watch our show to find out what we're doing for our seniors and their families, and hear from area experts and local business owners about their programs and services. Want to help? Find out how you can work with us to bring a better future to our seniors. Watch Coming of Age, 3:30 p.m. Wednesdays, only on Blab TV.
At FPL, we plan for storm season all year long. We're strengthening poles to better withstand severe weather. We're clearing lines to improve resiliency, and we're constantly training teams to act at a moment's notice. Because we're always working, always preparing. So when storms do hit, you can count on us. FPL, working for you every single day.
For the past 5 years, Blab TV has worked with the McCullough Institute and Plastic Surgery Clinic here in Gulf Shores to get our message out to the public. Blab TV works. I am Dr. Galen McCullough, and I am Blab TV.
I'm Kathy Holsworth, Artistic Director at Pensacola Little Theater. Join me on the first Monday of every month at 7 p.m. for the Center Stage, where me and my artistic friends talk about all things on the stage and at the Clark Family Cultural Center. Join us, won't you?
And welcome back to the hottest spot in town. As we are out and about this weekend, we are out and about in the city. Why? Because we believe that knowledge is power. Why? If we want you to be a part of it, we're going to tell you where it is. And today, I'm so pleased that I partnered there with Baptist that asked, well, can you all come out and do this live for us? I said, of course. Let's find out what we got to do. And I tell you, my girl, Casey, we're Baptist. Oh, but Casey and I go back so far.
Old friends.
I mean,
We've been doing these Saturday shoots since
Oh.
Girls Across the Bridge days.
Remember?
We bring out Sunshine Dance.
Didn't
Oh,
we?
yes.
And I mean, wow. And look at my girl right here. We were talking about UWF and the wheelchair. I mean,
wheelchair basketball game.
so Ball with that. I mean, supporting the community the same way we're supporting the community today. Making sure that we're sharing knowledge and wisdom with everyone about what their ability is. Absolutely. That's what you were all about. That's what we're all about. Yeah. Casey and I. My girl. You know, together. Oh my goodness. Like, oh, it's perfect. It's perfect. It's perfect. But it just shows for me that the part of giving has always been so many of us in the community. Exactly. Exactly.
It's all about the community and lifting everyone's quality of life and the way that they care for themselves.
So true.
And I cannot. I'm so pleased every time I tell folks, and I love the name. It's the tour. Right?
Yes.
This yes. That was really thinking outside the box.
I thought that was perfect when I saw that because normally you see health fair and people get so used to hearing that they kind of discount it.
Exactly.
Like when it said tour, and then you saw everything that Baptist is offering.
Exactly.
Partners such as the council.
Exactly.
And so many of us that are here today.
Exactly.
When you saw the ability to take a
When you connect those dots.
here and physically, mentally and physically. Oh my God.
And with your heart.
With your heart.
The heart is what I think.
And this is really for people at all levels. So we're here to meet you. You are as uninsured, underinsured, fully insured, commercial.
Yes.
There are things here today, resources, education
Most
that
certainly.
you need to help.
And Joy educated me on that when she was talking about uninsured, uninsurable. I said, can you really be uninsured? And she explained that. But then today, here's an opportunity for people to come out and take advantage of that. You may find out that maybe you are.
We have representatives from Florida Blue to help talk you through whatever level of insurance you might need. You need insurance.
Absolutely.
And so whatever level you are able to afford, they can talk to you about the marketplace, they can talk to you about commercial, they can talk to you about the plan that you have and help you get what you need.
Absolutely. Absolutely.
It's such a blessing. And there's so many persons that we work with all the time that are going, I don't understand Medicare, Medicaid, A, B, C, D, E, F, G, all of those different letters and numbers and how everything is working. It just to come here today,
Exactly.
for Baptist to be able to offer all of these things for free. One-stop shopping. Where do you get that?
You don't get that anymore.
No.
No
You
way.
need to call your family, your friends, your aunts, your uncles, your dogs, your cats.
Everybody.
Be here
The
today.
dogs and cats.
You know, and Melissa was talking about mammograms
Right.
earlier.
Yes.
You and I have talked for so many years
So
about the
many
mammogram program that we have at Baptist. Underinsured, uninsured, we've got you at Baptist. We have a program that provides those mammograms, no cost for those people that are uninsured, underinsured. At Baptist, we don't ever want a financial barrier to stand in the way of anyone receiving this life-saving screening. So even if you don't have insurance, come on out. We will take care of you. We have an amazing fund through our foundation that people contribute to year-round to make sure we continue to provide these screenings to our community.
It is so perfect.
Once again, going back to the part. That's just saying off the part of service. How many places you go and someone is making sure that whatever you need,
That is it.
medically, come on, what's the biggest expense in our country
you.
right now?
Exactly.
And for us to have all of this here today, and you all for be here today, to make sure that you're sharing it in the community. I just cannot say enough about this excuse. There's none here.
You're such an incredible resource for our community, Sonshine. I mean, you are constantly making sure that people in our community know what they need to know, how to access it, and to get here. So thank you for being here today to help us.
Thank you. It's from my heart. I mean, when it comes to the community, I'm totally sold out.
Yeah.
It's 365 days a year. I mean, whatever it is, I'm going to do.
And it's so genuine too.
Yes.
And what I love about you, here's my motto is you are exactly the same in front of this camera as you are
Never change. All day, every day.
Never
Not
change.
since the day I met you.
Thank you.
100%.
Well, you know,
But then
that
Casey hasn't either.
but you know, I get it. What you see is what you get.
Yes.
And I'm like this, why should I put it on a facade? And then when I walk out, I'm like,
Who do I
no,
Where am I?
I'm talking to them.
Exactly.
If I'm
No.
real, I'm real because of the fact the care that I have. I can't pretend about what I care about.
That's right.
I cannot give you something false about what I really want because I see in our communities what's needed.
Exactly.
Those that are fearless of going through it.
I see those who are fearful, who may not have what it takes to get the screening that they need. But what we're telling you today, don't let that be your hindrance.
No. And if you are scared, bring a friend.
Bring your friend.
Come together. I'm scared. You're scared.
Go.
Let's go together and learn about it.
Exactly.
And let's help break down those walls.
Exactly.
Let's help build that trust.
Exactly.
So you can learn about these incredible resources in our community, like Council on Aging.
Oh,
All of the phenomenal programs that they
Yes, they
deliver to the seniors in our
Yes.
community
Yeah.
that need companionship, that need food, that need air conditioners in the summer, that need heaters. And they're always out there advocating, fighting for our.
Exactly. And look at me, come on. This chick right here. That's, and look at that big shot.
I
got it together. I'm getting it. Here it is. Is it?
This is the three. This is decade. We're losing sunshine.
And there's some people.
I can't.
And I always have worked back and feels to me. I'm sure you've had this experience. If they talk to you away from. But then when it comes down to the draw, they won't come because of the fear. But don't be afraid of the unafraid. Fear is false evidence appearing real.
Exactly, 100%. And if you are afraid, find one of us.
Thank you.
Just come and say, "Hey, that was that lady. Would you
Come on,
come on,
there you
find
go.
us."
And we're gonna take you by the hand.
And say, "Let me get you to," because there's so many services.
Exactly.
So many services. Just as like Casey was saying, Council on Aging. We have all kinds of things. You've got CDAC, community drug awareness.
Oh, yes. I think I saw somebody just walked in with see that.
Yes. Denise Manasseh
Yeah.
is in there. Brian Wire is in there with the multicultural.
You know, Brian.
Now look.
If I know one thing,
Yeah.
when I'm at a community event, I know
He's gonna be there.
and he's gonna be taking a selfie.
Look, and here's what I'm saying. Let's get our picture.
We gotta get our selfie so I can prove I was here.
We gotta get Brian over here today.
Yes, yes.
When you talk about what Council on Aging, what you do is such great work.
Yes, ma'am.
I've worked with Jeff Nolan
Yes.
Oh, yeah.
Yeah.
all the way back then.
Yeah.
And we were just laughing that we used to go together to visit with the elderly. We even rebuilt a house through Council on Aging.
Thank you.
Yes,
Thank
we
you
did.
so much. We do those kinds of things. I mean, we have the opportunity for people with
Yeah.
ramps
Yes.
that don't have ramps. We help was just as Casey said about in the summertime with I call it chill out, and in the winter time with I call it winter warm up.
Uh-huh.
All of these opportunities that you have, but then we also have foster grandparent program where they can come in.
That wine looks pretty clean
Foster
here.
grandparents, 55 and over, persons who want to get back to the community, they're right, they're lively, they love children. Mention and children nurture has nothing to do with the foster care system. They receive a small stipend every month for what they do. Senior companions, persons who can bring someone to the doctor, who can take them to get their prescription, a person who can actually be a companion for them and negate that social isolation. Because that's how you end up back to sick.
What I love about these programs that Council on Aging has, it doesn't just benefit the foster grandchild.
I understand.
It benefits the senior.
Mhm.
Senior companion
Yes,
program.
yes.
It's not just helping the person that they're going to spend time with.
Right.
It's helping that person have a new purpose, right?
Yes.
Gives them a reason to get out of bed.
Absolutely.
I got to go visit my friends.
Exactly.
I need to get up today because I have
Thank you.
3 friends that are lonely, that need my companionship. But guess what? That's just filled their day too.
And that brings more life.
Exactly, and keeps you from the hospital.
Thank you.
But if you need it, here it all is. It ties together.
There you go. She got my hand. There
Because
you go. Put
Baptist
it
is a
together.
partner with us, the same way Sonshine partners with us, Baptist partners with us. It's an amazing connection. We stay tied together because we see the need in the community. We have the heart.
Exactly.
That's the amazing thing about the Pensacola area is our organizations work so well together. And I think you'll hear this theme throughout the partnership. Partnership.
Right.
None of us can do this alone.
Not at all.
It takes forging those partnerships and looking out who's not at the table,
Yes.
what resources are needed.
Yeah.
I know that this person has that need, so I'm gonna call Alicia, and I know that Council on Aging has it. But Alicia might say, you know what, one step further, I'm gonna call Community Health Northwest.
Exactly.
Because they might need services from me. It's a constant feeder and help. each other.
And I see that even with the connection, even with the conversation, the dots are all being connected.
Yeah.
because of the fact of what we've built over the years. It's a process, and that process is yet growing. I think it's evolving because of the fact when I see what's here today, what's being given. It's on the Saturday morning. I see these two from east side just coming over.
Yeah, that's right. Both of them.
Both of them just walking in. But think about that, ladies and gentlemen. When you do that, here's what we're taking the time to take the Saturday morning, and God just gave us such a beautiful day.
Oh, gorgeous.
And it's not as hot. Come on, guys.
And remember, no cost.
No cost. We're gonna do it here. No cost.
Come on out, Harmony. Learn about these resources. Come get some healthy snacks.
Yes.
Make some new friends. If you're lonely and sitting at home today,
Don't do that.
stay at home.
Please don't do
Come be
that.
friends with Sonshine. Come be friends with Alicia. Come be friends with
Easy. You know, we've been friends for so long. I mean,
Yeah.
it's like sister.
Yeah. I love it.
I mean, but it is, but I don't care what we do. We're always coming together with the ideas to help with the community. And that's what it's all about. This is the tour. This is the first leg of tour.
Yep.
And I love the fact that when we talk about wellness, we're not just talking about the headache or we're talking about it encompasses so much.
body, mind, and
And so
spirit.
there you go. Come on.
You know?
It does. So here's an opportunity for you to come back. Go get your neighbor. Call your sister. Honey, I don't want to go to the mall today. Take me away.
You can get your steps in here at Baptist 9 Mile Medical.
Exactly.
9 Mile.
And just please come on out and do that because it's so you can't miss it. If you're coming down University Parkway, if you know where Circle K is, because they got the best coffee here.
Corner 9 University.
9 Mile.
Rouse corner W.
That's right.
Yeah, I couldn't believe it. I think they got the best,
And it's pretty good.
I think they got the best coffee in the world. But ladies and gentlemen, we're gonna be here broadcasting live to let you know what you need to do to come by to be a part of. And it's always reaching our community by serving. That's what we do. We're looking to see you.
You finally found the perfect car in racing blue. You even got them to throw in the LED fog lights for free. Auto Owners insures your car because some people never learn to parallel park. That's simple human sense.
Ask the Messick Insurance Agency in Pensacola if auto owners make sense for you.
Keep going, more.
Many who consider facial plastic surgery are concerned their results will look unnatural. But with over 20 years of serving the Pensacola community, his thousands of satisfied patients have made Dr. Derek Jones a trusted reconstructive and facial plastic surgeon known for industry-leading results that look natural. Call 850-484-FACE to schedule a consultation at one of our locations in Pensacola and Gulf Breeze.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
At Pensacola Habitat for Humanity, we believe every child should have a safe place to grow. That's why we work with you and the community to build not just a house, but a home.
She worked very hard to get this house. I really appreciate that because, if it wasn't for her, I wouldn't be here right now.
When you help build a home, you build a future. Pensacola Habitat for Humanity.
The Emerald Coast Utilities Authority's state-of-the-art materials recycling facility processes recyclables for communities throughout the region, lowering need for more landfills. This highly efficient recycling service accepts glass, paper, cardboard, plastics, aluminum, and more. But we need your help. Please make sure your recyclables are clean of garbage, food, and liquids. Also, please remember that plastic shopping bags, foam products, or yard waste are not recyclable. To learn more, go to livegreenecua.com.
We're from Lamb.
And welcome back to this Saturday edition of Sunshine's Corner. It's like I tell you, if there's something happening in our community, we are going to be right there. So look, and I've got my see that can happen. But I gotta say this. But
Yes, National Night Out.
National Night Out. Rain, yes, in the house. But we had, I remember. I only think about it when they, at least. Yeah, there's some, water, they call them. I mean, when there's, what you do is great for the community. We're talking about that. You of all people in jail. Now, can I hear you on the show? Well, you're from, okay.
Come help me grow Scambia.
Okay, well, introduce yourself and tell me what you do.
I'm Teresa Zarchowski. I'm the marketing and outreach coordinator for Help Grow Scambia.
Okay.
We're partnered with the ARC and we're funded through the children.
Oh, really? Well, tell, okay, now. Yes, well, you're right. She's right.
See that? Yeah, see that's been around for over 50 years. We work on education and awareness, bringing people awareness of substance use disorder.
Right.
And education. So last time I was on the show, we talked about National Night Out.
Yep.
A great thing to bring different words.
You coming back?
Like today.
Pensacola?
I'm out here today and come out and about free resources, but just educate yourself. Like Help Me Grow is so amazing. I'll promote her because it's about looking at families from a perspective and helping our very young children get it right.
Exactly.
And when we are able to do that for the community, we feel for free. Our services are
free.
Yeah,
It's free.
but you help those families grow in a healthy way. And your child's struggling. And that's the great thing about having this event here at the hospital. It's getting support from the hospital, but also available to anybody that wants to.
That's what's so amazing about it.
Our community, as far as outreach and reaching out to people, is amazing. It is.
We were just talking about that.
It is about us bringing this together and we want to share. We want to make sure everybody has a voice, an opportunity to bring joy to people, but also to bring those resources. Or the not share.
I tell you.
To let them know it's available.
Exactly.
Especially as a mom, you may not know these resources. And so I think our community is great about all of that outreach. What's doing that working together with different organizations to come together and put on these things.
Right, exactly. And that's so much, the connection that I see, everything connects about when you. And I mean, it just, we had just talked about it was on the first break. About some of the things that I've taken over.
Oh, absolutely.
Educate people on things that are.
Yeah, because we know we have a vaping epidemic.
Yes.
And fentanyl's horrible drug that kills people. But when we're looking at our young people, they're vaping now. Have younger women. So it's a well, sometimes they may get it from a community member, but sometimes they may get it from a family member. We really are unsure of how they're getting it sometimes. But they're still choosing to use this because in some ways it's popular, peer pressure, whatever. But it sets up this trajectory of sometimes problems.
Oh my goodness, like that. It's not hard because I see. I had to go back and say that because even when I'm out, sometimes I see the young people. They think that's cool. Oh, this is strawberry, or nothing. I mean, it's
Come to me and see that, and I'll tell you all about it.
that's right. I want to tell you that's not just no strawberry. Maybe it's like Jimmy over there eating that candy. I don't know, but he's getting short. I mean,
so we refer to Help Me Grow,
right?
And it's amazing what they do because we were just talking about that this morning. I was like, I need some help. I've got this parent, and where do we go? Where can I help this parent go?
Right.
So
tell me about how that works.
Okay, so Help Me Grow, what we do is we do developmental screeners for children ages 0 to 10 days. And we also provide direct services out here at the Gym for Children 0 to 5 who are showing some signs of delays that aren't meeting those milestones that they should be meeting, like picking things up or speaking, when a parent feels like they should somebody go and see, if there's a delay there. And then we also do care coordination and referrals. So if the child is showing more delay than what we feel we can support, we refer them to early steps, and we have to do that process to make sure they're getting connected to the resources.
Oh, wow.
And it's free for Scambia County residents.
That big word is what? Is what?
It's free. So you're setting up your child and your family for positive.
Exactly.
And it's not, I think, and you probably see it a little bit more. Is there a stigma?
Took the words off your mouth.
Yes, of course. I mean, you know, you think about your own child in school and that look there, you need a little bit more support. You don't, you know, as a parent, you may not want them late.
Right.
Well, you can make a choice. Delay. Let us get in there. Let's start working on them or with them and getting them the support they need to reach them as much. So maybe when they start and they're bigger than I mean, wow, you know, maybe let us help them with that. And that's okay. But if they're we're here to help them with that.
Unbelievable. But everything that you need is good. Just have to go get it. And then don't be, and if a person has a family member that does not, you hearing this and find out more, look, there's help for you. So take that necessary step to get it. And when you said a moment ago, you said that the epidemic. I think about even a year ago when I learned was more. You know, talking about, I was like, oh, really? I didn't really talk that much. That they was being educated so well. Is it as strong as still in the community as the epidemic as it was talking about?
As far as maybe, absolutely. Yeah, it's about educating, but fentanyl, it is still a killer. So we still have issues here in Escambia County with us having a high death rate due to fentanyl. However, there's a lot of resources now, so we're having less, I would say, deaths, but we still have a lot of overdoses. But again, when we're looking at families, you know, our young kids, I try to focus on all community members. There's call us, we're kind people. We want to help our community grow. We live here.
Exactly. You
It's
want it to
our
be known.
community.
Exactly.
We want it to thrive and live the best that we can.
Right.
And part of that is reaching out because there's no stigma.
Ah.
We're there to give our hearts to everybody that lives in this.
When you say that the death rate is somewhat slowing down with the fentanyl, what do you attribute it to?
Education,
Okay.
knowledge, but also the availability of Narcan.
Now, that's what I want to go to next. That's what I was alluding to. Now, let's talk about the Narcan and how it works. You got to know how to do it, right? You just can't go.
Pretty simplistic. It really is. So anybody can administer Narcan. It's an aerosol spray. I believe Jayla's voice brought some.
Yes, it is.
You'd be able to see it. So it's an aerosol spray. If somebody that you find or a family member is still breathing, you're not sure what's wrong, they're almost in an unconscious state. So you administer it through the nasal passage. So you don't prime it, you just plunge it in one nasal passage and hopefully it starts to breathing.
When you say don't prime it, what do you mean?
So some people like want to test it. You don't test
Oh,
it.
like spraying it in there.
Yeah, and then, you know, like when you're, think of it this way, when you have a cleaner or like Lysol spray, you want to make sure you're spraying in the right spot. No, you don't do that. You don't do that with Narcan. You just stick the plunger in the nose and you plunge it. And you don't sometimes know what's wrong with your vision. Science says that it's not going to hurt anybody if it's not. So maybe it's a diabetic, but you don't know. You're trying to save a life.
It won't hurt that person if it's not.
If it's not, it's not going to hurt it. Okay. And then you need to call EMS. You need to call 911 because
Right.
we want to get them into services. So I think it's about education too. That's brought our district down.
And that's a good thing because at one point it was so.
It is very high. Plus now, CORE, it's called CORE. EMS has what's called our CORE program. So when they go to a scene and it's a fentanyl or an opioid overdose, they're able to get them into services on the ground. So we've made that communication easier. It's like, we want to get, like you said, get out there. Yeah, and we want to get them at 0, 1, 2. We want to, because their trajectory of life, the family is going to be so much better.
It's just, I think it's so unique. It's so uncomprehendable when you say little kids.
Oh, that are baby?
Yeah. I even have you had anything with younger kids?
Other drugs?
Yeah.
So there is what we have here in Florida, it's called the Florida Youth Substance Abuse Survey, and we started in middle school. Are they exposed to other substances at a younger age? Absolutely. Especially now when we're looking at edibles, like marijuana edibles, they're definitely exposed, and we do have, Poison Control Center, looks at that. So.
Did you say edibles, like what, you just get the grass and eat?
Girl, you need to. Sunshine, you need you need to take on. So if you want education on that, call Denise and see that.
Yeah, don't feel.
So it's basically they take the plant and put it in a liquid form, and then they put the liquid THC, which is the addictive drug that's in all marijuana plants, into an edible like gummies, usually gummies.
Here's what.
Yeah, you ought to see some pictures I have.
Why can't I get you on? You have to bring the picture so I can
I'll
see.
bring the picture.
And we got to share because when you say, and I think you just go, eat that.
No.
Put a cookie there.
Yeah, they basically, so when people think marijuana, they think, oh, it's natural, it's an herb, and it is. It is a plant. Doesn't mean it's safe. Arsenic's a plant too.
Come on.
Kill you.
I always say this. I'm glad you said that, Denise, because look, I tell you like this, I've got to have something can mess with me and cause me to do something different.
Oh yeah.
I don't want it. Because if that's something that can go in me, that's what it takes to make me feel good. No, let me tell you what make you feel good. You don't need that. I think that's so. What is it that's bothering you? That's within you that you want to take a smoke or eat this thing, and that's supposed to make you feel good.
And I want to say, maybe it's just maybe there's some trouble there. They're just looking to get away from that. So maybe there's a pain that they feel they're.
Just talk to me. I'll help with your pain. Don't eat that stuff.
Great coping later sources here that can help people.
Doug, if you want.
Numbs in there.
Oh,
For free.
okay. I said we're having such a conversation today. I don't want to break it, but I got to break it. I'll be back with more right here on Sunshine's Corner.
My name's Kelly McLeod. I'm the owner of Bella Magazine. Bella is a source of uplifting and inspiring content for the women of Pensacola.
I think the magazine is just so thoughtfully done. There's a lot of attention to detail. The stories are really good.
You've got seriousness, you've got fun, education, fashion. It just encompasses everything.
Women are multidimensional, and so is Bella.
From the efficiency of American natural gas and the dependability of nuclear power, to the strength of Florida's sunshine and the flexibility of advanced battery storage systems, we leverage a diverse mix of energy sources to power our growing state, ensuring reliable, low-cost power for your home or business whenever you need it. FPL, working for you every single day.
At the Hearing Center, the journey to better hearing is unique. A medical model and a personalized, high-quality patient experience is the perfect combination for your hearing health care. Our audiologists take the time to listen and help you understand, while using research-backed practices for the delivery of hearing aids. Choose a professional, not a product, for the best hearing possible. The Hearing Center, a better experience because it's your experience.
Well, I think it's all about local, and I'm a big believer in local. So I think anytime you can carry a message out locally, it's important. And I think it's anytime the person that delivers the service can also deliver the message, which is unusual. So you have the people that actually deliver the project doing the talking, and I think that's a huge difference, and really makes a huge value difference for the consumer. So I'm really just so grateful that we have this local opportunity with Blab TV. My name is Quint Studer, and I am Blab TV.
And welcome back to the hottest spot in town. I tell you, we are out and about in the community today. And I am, I love knowledge so much. I am being re-educated on a lot of things And I've got to say to you, Joy, to Baptist Healthcare, all I want to do is say, thank you, thank you, thank you for taking the time to do what you're doing because it's so beneficial. When you told me about, oh, look at the cheers from the phone.
I don't know what you've been to say.
No, when you were talking about how many people that have already come in here, we've only been here less than an hour.
Okay.
And look how many people have already come in. And Brian, I got to give you your props.
Oh, okay. Thank you. Appreciate it.
When there's something in this community,
Oh, baby. If Brian ain't there, you probably need to go out the door.
it ain't nothing else.
And that's you might need to go the other way.
I mean, because I just want to say that because I have noticed, I don't care where I go. Somebody will say, hey, Sonshine, let's get a picture. Because you are there. And that takes a lot. When you are doing with the Gulf Coast Minority Team, I commend you because that's what it takes. You need to be seen. You need to not just talk about it. You are being about it.
Well, as you said earlier, I have chills because being around great people, I try to follow everything Joy does. She's amazing with the community. I follow her around. I call for my vice president of her fan club. And then Sunshine, I feel like I'm treasurer of yours. So I try to want to follow you around because y'all do great things. And being around those things is so awesome that they do. So I'm glad to be here today. I'm learning things too by walking around the room, talking to people. I got my screening form right here. It's easy to fill out. Just fill out the screening form, get things done. And I tell you, it's so easy to come out. Please come out today and get this knowledge that's developed for you. Get these health screenings that are done. It is so important for our small businesses because their businesses don't have insurance. They don't have benefits.
But watch this. We got somebody in there that can help them.
Can help them out today.
Doing Boots here.
When you said that,
They actually sacrifice their health for their businesses and their family. And the health is so important. You can't help others when you can't help yourself. So it's so important to get this work done.
that's right. Hold that screen up, that sheet up again.
So easy to fill out, and you fill this out.
It's 1, 2,
things
3.
you need.
And Joy, you are on it. You told me, I got to say this now. We're just going to keep this in it. It's not a bad cup.
Yeah.
You know what happened with that cup?
Hey, I'm gonna tell you I'll tell you later. But if a person goes in for an interview with him,
Thank you.
with a Starbucks cup,
That's it. We know about that. That interview is messed up. You won't get further than that.
you gotta know how to.
You gotta know how to
business
do
with
it.
your people.
Do business with the people.
That's
Do
right.
business with you.
And if I'm your people, if you watch me every first Wednesday, come let me hug you.
Come on now.
And let me boss you around a little bit today.
Thank you.
You do these screenings.
But that's what it.
That's what it takes. Sometimes. I got a guy in there now. I was like, hey, you want to get your
Said, wait a
screening?
minute. Let me do what you
Bob, walk around. He said, I said, you want to get your screening? He was like, well, I said, do you want me to hold your hand? My husband ain't mad because I get your hand. I need you to understand that I want you to live prosperous.
Yes.
You can't do that without me.
Exactly. And ladies and gentlemen, we're talking about this thing. It is so much fun. I am so glad that we decided to do this because I would have been watching Andy Griffith.
They didn't have a doctor on Andy Griffith.
Wait a minute. There was Floyd the barber.
Keep going.
There was Goober.
Mm-hmm.
There is Gomer.
Mm-hmm.
There's Barney. There's Aunt B. There's Miss Clara Edwards.
There's a jail.
There's the jail. But nobody got sick.
No help.
No, nobody got sick in there. There was a teacher, Miss Colonel. Do you not know I like that show? No, but I like that.
Well, it's a funny story. I'll tell you real quick. The story was that everybody in the town was single, other than Floyd, who was a town drunk. Not town, Floyd, the town drunk was the only one that was married.
Otis.
He's the only one that was married, and he was the town drunk. The rest was single, and they're pretty happy.
But you know what? That is so funny. I never thought about that. Otis was married. He's nowhere, and they got to stay here because they don't want to go home.
Exactly.
I was taking himself in that one cell and
Have a good time. He threw the goat down there. Don't dynamite. He's wait a minute. Let me stop. Y'all have to see what I watched. It's because of the moral of the show.
Exactly.
It's such a family-oriented show.
Yeah, just like this. The moral of this show today
is family.
How often do you broadcast on Saturday?
Not often at all. And I was so pleased when you asked that we do this. And David and Jimmy and Doug and all of them, I said, we need to be there. And here we are. But I thank you for that partnership that we have, that we make things happen. And today you can get screening for so many things. I just got to call something out. Look at Melissa talking with this person who walked her through the door.
Yeah, you see my head keep moving too, right? Because
Yeah.
I'm paying attention to all the moving people.
They are right. I mean, that means I'm making sure you understand.
Exactly.
I'm letting you know that this is love that I'm going to walk
Well,
with
actually,
you.
she's not taking her to the door. She take her to the rehab over house.
Oh,
Ball.
come on now.
You know, it's great for men and women because men at times don't take care of the health at times. Those prostate screenings for them, mammograms for women, it covers everybody. So everyone is coming out here and get some of this screening.
I bullied him into doing it.
Hey, no, you didn't. I was willingly doing it. It's so slow. I was willingly doing it.
But it's all good. And I tell you what, I can't believe that, you know, when you do my show, and even whenever we have lots of information, this hour go like that. Boom.
It does.
And I'm looking at my watch. I wonder why he's going. Okay, but
Time up.
because time is up. But the fact of it is, we got it. We gonna play it again. Okay, so I want people to see that they can get this done to 1 o'clock this afternoon. You still got time, but do not allow something that God has opened the door that you can have it without any cost. You can come by here today and get tested. You can come by here today, get information. If you want to find out something where you need to do and you don't know, men, prostate screening, you're not going to be peace out. They got a needle. They take
Just scared them up. And I will say
Not
this.
peace out.
You see, that's it.
Yeah. But I will say this. With the rebroadcast,
Yeah.
469, pray.
468. That's right.
227-7729. Call us. Tell us you watched the show Saturday and you need screenings. We'll make you an appointment to come up there and get it.
Exactly.
And another piece too, Sonshine, come see this beautiful facility.
Oh, isn't it
You
beautiful?
don't know that it's really here too much, and coming and see the facility, know what's in your community, know what's close to you. It's so valuable to know what any resources are available for you. This is an amazing facility, and you can know what's to do when you have an issue problem.
Exactly. And I gotta say this, Shabbat, continue to do what you're doing because the fact of what you're doing is absolutely marvelous. You're reaching the community by serving. You're bringing it to them by serving, and I applaud you for that. And of course, with us there at Lab TV, and of course, Sunshine's Corner going to be there for you, bringing you the information, reaching our community by serving. I'll leave you as I do every single day, and I mean this from my heart. Never, ever, ever lose your focus. Always remember, if you keep God first and know this, you're going to get total success. Have a great weekend and keep shining while I'm going. Come on out to the event. Come on out to the event. We're right here on University Parkway. You can't miss it. And I tell you, Joy, give your last words. Come on. Give me.
Y'all, I need to see you. I need to see you. I need to hug you. I need you to get what you need. All right.
Brian, you got 10 seconds.
Thank you. Please come on out.
Throw that finger.
Right in here.
Easy.
Simple form. Easy
Simple
to do.
form. Simple form. It's simple. So, ladies and gentlemen, they made it so simple for you. And that's how it works. We're great to have visited today. Hopefully, we'll do it again soon. Know that I love you with the perfect kind of love. Keep shining while I'm gone. Have a great Saturday.
Sunshine's Corner, being brought to you by Quint and Richie Studer.